Welcome to an overview of Support at Home. Before we begin, we invite you to slow the speed of this video or add closed captions in your primary language. We recommend pressing the pause button to make these adjustments before continuing. Support at Home is a partial financial subsidy program administered by the Institute on Aging. For many years, adults have found it difficult to afford home care services to allow them to continue living independently in their home or return to community living from institutional placement. The goal of Support at Home is to serve adults living in the community by providing resources for needed home care that are not available through any other means due to financial challenges. In 2017, the Department of Disability and Aging Services, known as DAS, determined that the Institute on Aging would implement Support at Home. We provide a partial financial subsidy, called a voucher, for home care services for adults that meet our eligibility requirements and are willing to pay a portion of the home care cost and participate in program requirements. This video offers an overview of your options within the Support at Home program. Prospective clients in the process of applying will also have access to a more comprehensive client orientation folder. This video provides important information to know before you begin an assessment. Let's review our eligibility requirements. To be eligible for Support at Home, you must continue to meet all of the following requirements: resident of San Francisco, 18 years of age or older, monthly income does not exceed 100% of the current area median income, demonstrate that your assets do not exceed $40,000, excluding one house and one car. Demonstrate the need for help with 2 or more activities related to daily essential and routine self-care, such as eating, bathing, getting dressed, toileting, transferring, and continence, and/or instrumental activities related to independent living, including managing medicines, shopping, meal preparation, using a telephone, transportation, housework, and laundry. Demonstrate financial need for subsidized home care. Pay a portion of the home care cost, called a copayment. Participate in program requirements, including monthly telephone calls and annual reassessments and evaluations, and ineligible for other subsidized home care. Let's review our eligible home care services. The following home care services may be purchased with your Support at Home copayment and voucher amounts: domestic services such as grocery shopping, meal preparation, general housework, and laundry, non-medical personal services such as bathing, dressing, grooming, transfers, oral hygiene, and bowel and bladder care, or healthcare support services such as medication reminders or accompaniment to and from appointments with physicians, dentists, or other health practitioners. To continue to be eligible once you're enrolled, you are required to manage your own home care and communicate directly with your care provider, pay your copayments when due, complete a monthly review with your assessment specialist by telephone, communicate about any gaps in your ongoing care, and participate in at least annual reassessments. If there's someone you trust that can help you manage your Support at Home responsibilities, be sure to notify your assessment specialist right away. The Support at Home program isn't case management, but with your permission, we're happy to coordinate with your responsible party, whether that's a POA, social worker, money manager, family member, or neighbor. There are 2 ways to use your copayment and voucher amounts to pay for home care services: through an agency and through an independent provider. Once you complete our assessment and you're determined eligible, you may decide between agency mode or independent provider mode and move forward to complete a Support at Home service plan. Your service plan will list the voucher amount you have access to after you contribute your minimum payment, called a copayment. Each service plan is based on your unique assessment and your unique preferences and needs. If you choose agency mode, the agency finds, screens, hires, trains, manages, pays, and if necessary, fires your caregiver. In independent provider mode, you do all these things yourself with some help from Homework Solutions, Inc., a payroll and payroll tax administrator. Does your caregiver need particular language skills, the ability to lift or operate special equipment, or previous experience working with a specific disability? Also, think about your personal preferences. Would you be more comfortable with someone from your own culture? Does it matter to you if your caregiver is a man or a woman? This is a good opportunity to also consider free or low-cost services you can tap into that could supplement or replace some caregiving responsibilities, such as home-delivered meals, groceries or pharmacy services, friendly visiting services, and adult day centers. Getting clear about what you need and what services are available may help you determine which provider mode will be the best fit for you. Supported home centers around client-directed care, which means you have the right and responsibility to manage and maintain your home care. You're required to engage with your provider mode, an agency or independent provider, and start home care services. Your supported home voucher automatically expires if left unused within the first 30 days from completing your service plan. Whether you choose to access care through an agency or an independent provider, you'll need to consistently manage and maintain an ongoing relationship with them. Make your expectations clear from the very beginning. We recommend making a list to discuss with your caregiver. Be sure to tell them when they're doing a good job and let them know when you want them to do something differently. If you've tried and are unable to maintain your relationship with your provider and need to switch provider, notify your assessment specialist immediately. We can help you switch provider, but it may require a new service plan or enrollment paperwork. You may switch up to 3 times, whether between provider modes, agencies, independent providers, or a combination thereof. Check with your assessment specialist about our limits on switching so we can help you plan to stay enrolled. In order to stay enrolled in supported home, you are required to pay your copayments on time. Your copayment is always due first and pays for home care services prior to the availability of your voucher funding. In agency provider mode, your copayments are due to the agency at the beginning of the month, a full month prior to receiving home care services. In independent provider mode, your copayments and timesheets are due every 2 weeks. In both provider modes, there's a firm limit on late payments. We recommend enrolling in auto payments and planning ahead to avoid losing your voucher funding after too many late payments. We require a monthly check-in by telephone. At least once a month, you'll need to speak with your assessment specialist over the telephone. This part of the program is mandatory because we know it's essential to maintaining your voucher funding and supporting your safety at home. During this call, we'll check in about your home care, review your current service plan, and provide program updates or resources. This is also your opportunity to share about any significant changes and offer feedback about our program. During this monthly call, we'll also discuss any gaps in your home care. For example, sometimes folks leave San Francisco to visit family or go on a vacation. We allow for a one-time, 1-month hold on services. Perhaps you're planning to have a procedure done and you'll be staying in the hospital. For any hospitalizations, we're able to keep vouchers on hold for up to 2 months. If we're unable to reach you after making 2 telephone calls, we'll send a letter in the mail asking that you give us a call as soon as possible. If we're unable to reach you within 2 months, your voucher funding will be at risk. Completing a monthly telephone review is mandatory. Reassessments. At least annual reassessments are required for continued enrollment. This means every year you'll need to prepare all of your financial documents and review all of your functional needs with your assessment specialist. We'll give you advance notice so that we can set aside 1 hour to 2 hours to help you complete your annual reassessment. Urgent reassessments may be completed when there's a significant change in your needs. It's important to note that reassessments may result in discontinued eligibility, a change in your copayment amount, a change in your voucher amount, or a new service plan. Let's compare agency versus independent provider mode. Agency mode. If you choose agency mode, you have a separate relationship and service agreement with the agency approved by Supported Home. The agency handles the hiring and firing of caregivers and everything in between. Compared to hiring an independent provider, this option costs more per hour, but if your caregiver gets sick, the agency can send a replacement, and if your needs change, they can assign a different caregiver. The agency will also manage payroll and payroll taxes for their employees. With an agency, you have less choice in the caregivers assigned to you. They do their best to connect you with someone that's a good fit for your needs. Sometimes it takes a few weeks to a few months to establish which caregivers you prefer to work with. You will have a separate relationship with your agency. You will sign a service agreement, discuss a payment plan, and schedule shifts with your agency. It is your responsibility to communicate directly with your agency. Independent provider mode. If you opt for independent provider mode, you will find, screen, choose, and hire one employee, and only one employee, to work as your caregiver through Support at Home. Your caregiver is your employee rather than an independent contractor, because they follow your instructions on how to care for you. If your caregiver worked as an independent contractor, they would make all the decisions about bathing, medication, and different activities to do without consulting you or your doctor first. They would also be responsible for providing supplies instead of using yours. Also, your caregiver is expected to take care of you during the times you've specified. If they were an independent contractor, it would not matter when they worked, just as long as the job was completed by a certain deadline. In short, caregivers are classified as employees and do not meet the independent contractor criteria. The hourly rate will be no less than the current minimum wage in San Francisco. At no additional cost, we require that you and your caregiver enroll with the Payroll and Payroll Tax Administrator Homework Solutions, Inc., and submit timesheets and copayments every 2 weeks. You're the boss, so you're responsible for paying all employer taxes and wages to avoid being subject to tax evasion charges and related back taxes, penalties, and interest. Your copayment and voucher amounts will be applied to taxes and wages, but you may need to pay more out of pocket, depending on your home care needs. Homework Solutions will ensure that you're compliant with state and federal tax requirements. They'll help you with your bookkeeping. They will track employer taxes and reported hours worked, up to 3 days of paid sick time, wages, and employee taxes. Your assessment specialist will help guide you through the process of enrolling with Homework. A step-by-step guide of the Homework Solutions enrollment process is also available upon request. In order to set up your free account, you'll need to identify yourself as a Support at Home client. In independent provider mode, you're an employer in the state of California. We recommend that you contact an insurance provider as soon as possible to learn about and obtain workers' compensation and other employment insurance protections. Complying with all the legal and tax formalities sets the tone as you build a relationship with your care provider. The hassle of figuring out the tax rules, securing the necessary tax accounts, and dealing with all the paperwork and calculations can seem overwhelming. That's why we've partnered with Homework Solutions to help you navigate all the payroll and tax compliance responsibilities. Independent provider orientation. When you hire an independent provider, you're required to pay your caregiver to attend a 1-hour orientation training. Regardless of your care provider's background, this 1-hour course is mandatory for all the independent providers in our program. In addition, you must include the 1 hour of orientation attendance time on your caregiver's timesheet to compensate them for completing this requirement. Before we come to a close, we want to share about our commitment to making our program available to as many people as possible. If you have suggestions about how we can improve our accessibility, we're open to your feedback. Currently, we offer interpreters for phone calls, interpreters for face-to-face visits, program materials may be read aloud, Cantonese and Spanish document translations. We're able to use pocket talkers, larger font materials, and smartphone apps, and we may make additional accommodations upon request.